thank you for inviting me to speak on your website. My name is David Hopes. I'm a GP partner here in Tavistock, which is a small town just north of Plymouth in West Devon in England. I've been a GP partner here for 15 years, something like that. I'm also, I work for the Peninsula Deanery for Health Education England, and I'm Associate Dean, really involved in training around the Plymouth GP training scheme, which I've been doing for ages really, for almost 20 years now, goodness. And I do a few other bits and bobs. I'm an appraiser, and I'm an educational supervisor for trainees in the practice, and I've done a few other things along the way. That's me. Why did I choose my specialty? I think it probably chose me a little bit really. I went straight into general practice from what used to be, what was your house officer years, which is what came before foundation years. And to be honest, I think when I was a student, I just decided that I really didn't like hospital medicine, if that's fair to say. There were lots of things about it I didn't like. I particularly didn't like the hierarchy, the depersonalisation, some of the, just being in those big hospital buildings just really freaked me out. And then I went out on a GP placement and it was just amazing. There was like this lovely guy that I was with who'd been doing it forever, and he just knew all his patients and he saw them at home, and he was based in the community, and he just saw loads of really cool stuff and seemed to know everything about everything, and I was just in awe, and I thought, yeah, I could do that, that's great, that's the answer to not wanting to be in a hospital for the rest of my life. So I think I chose it really initially because I didn't like hospitals, but ultimately because I just wanted to work in that environment. So I mean, I don't know how much you know about GP training, but it's a 3-year scheme, vocational training scheme, and really I went straight into that out of what were the predecessors of foundation jobs, and I went straight through really. So I was sort of as young as you can be when I qualified as a GP. GP is only a 3-year scheme. It's quite, I mean, considering we've got the biggest syllabus, we have the shortest training scheme, so it's a strange situation, but it's sort of historical and political, and we're stuck with it. But essentially, I became a GP very, very early in my career. And I think like a lot of GPs, I sort of didn't feel quite ready. And like a lot of people, I certainly wasn't ready to settle down. So I was a locum for a few years in a range of practices, particularly around Plymouth and the sort of surrounding country areas. And then ultimately I went into being a salaried doctor in an inner city practice for a few years, which I really enjoyed actually, a really different experience from my training experience. And then ultimately I came back here, which is Tavistock, which is a small town, which is actually where I did some of my training, and a partnership came up, and I sort of felt like I came back home really after a little adventure. I suppose the other bit of my career is the educational side, and really again very quickly out of VTS I got a development post on the GP training scheme to develop educators really, and I did that for a year and really sort of never left, and I've just got stuck here and nobody seems to be able to get rid of me. And over time I sort of got a job as a training programme director, and now I'm Associate Dean, really I think just because nobody else is prepared to put up with it quite as long as I am. And I'm not planning on going anywhere soon. And I guess along the way I've done a few other bits and bobs. What else have I done? I did some medical school, small group teaching for a while. I did some medico-legal stuff, that was awful, I hated that. What else did I do? I've done appraising. I've been an appraiser for about 5 years, which is sort of going around meeting other GPs and a bit like supporting qualified GPs in their job, and not making the GMC edict too onerous for them, but really trying to support and help them. So I've got a nice mixture really. So where I am now, I have a balance of clinical work. I work 2 or 3 days a week in the practice. I do a couple of days a week education, and maybe half a day every couple of weeks of appraisal work, and it's a really lovely mixture, and I'm really pleased that I've landed with that. I'm very happy. So I guess your website's mainly aimed at people overseas, and general practice is a bit of an enigma sometimes for a lot of people, because it doesn't necessarily exist in the same way in all the countries that people have trained in. So really, I suppose the first preparation is working out what it is and whether it's for you. I mean, I suppose there's the practicalities of how we work as GPs in this country, what we do day to day. You know, we really cover the whole breadth of medicine. We cover the whole of the family, and we see people longitudinally through their whole life, really. So we're looking after newborn babies. We don't deliver them, but we look after them shortly after birth, and pregnant women, but we're also looking after the very elderly, people in palliative care. So, you know, and everything you can think of in between, across families. And we're based in a community. We live in a, you know, I live and work in the same place, so you know, you've got sort of real deep links to that community. So if that's something that makes you excited, then great, you might like GP. If it's something that makes you want to run to the hills and go, oh my God, that sounds hideous, then maybe it's not for you. And really, I would, you know, if you can, you know, find out about it, visit a GP surgery, or read about it, or watch stuff on the web, or look at things like the Royal College of GP's website, which has loads of stuff on it, or the other websites. I mean, Bradford VTS has got tons of stuff on it. We've got some stuff on our Plymouth website. Lots of VTS training schemes have stuff on their websites welcoming people to general practice, and really it should give you a bit of a sense as, you know, whether you're on the right track, I suppose. Beyond that, I suppose, then there's the practicalities about how you get in. The National Recruitment Office website, the NRO GP website's really helpful. And it's got tons of advice and information about the exams. The exams are changing, and my understanding is they're just going to be sort of situational judgment and knowledge testing now. I think they're planning to get rid of some of the face-to-face stuff they have been doing, but I'm not certain about that. So I guess working out that you've got the qualifications, working out you've got the experience, working out you've got the right information about the assessments and, you know, what you're going to be expected to do, but most importantly, working out if it's the right career, I think. If it is, then you'll love it. If it's not, then, you know, it might be a wasted lot of effort for you. There's lots of things. I think I've sort of touched on them a little bit before. I sort of like interacting with people, and general practice is about interacting with people. It's been a bit weird recently with the COVID epidemic, because we've all been behind masks and on the phone and on video link, and for GPs that like talking to their patients, that's unsettling, uncomfortable and a bit odd. So I think first and foremost it would be getting to know people, getting to know their families. I mean, we visit people at home, which I know we moan about it sometimes, but it's just fascinating because you sort of see people in their natural environment and you get to know them. And I think that's my favourite bit. GPs make most of the diagnoses in the NHS, and we see most illness before it presents to hospitals. So there's a sort of diagnostic element to it where you're trying to sort of chase diagnoses down where they exist. And it's just fantastic working with colleagues. Most GP practices in this country are partnerships, or certainly groups of GPs working together. And I'm really pleased to work with a bunch of really just fabulous colleagues, both GPs, nurses, receptionists, managers, HCAs, all the rest of it. Everybody who works, you know, the community staff as well that we work with, the physios, the OTs, the community nurses. You know, it's just a real, people always sometimes think GP is a bit of a solitary thing, and they're a bit, you know, I like the buzz of the hospital, but actually, you know, we're a reasonably big practice, 8 partners, 15,000 patients, and we've got a real sort of sense of teamwork going on, which I really like. There you go, that's a few things. So salaried and partner GPs. So partners, I mean, the way general practice works in this country is we're lots of little small businesses run usually by a partnership, a group of GPs who sort of own the business. So for me, there are 8 partners, I've got 7 colleagues, and between us we each own you know, that percentage of our business. And so we run it as a small business, as you'd run a shop or whatever else you'd run. So we have income from having registered patients and from doing stuff that GPs do, and we also have expenses from paying our staff and you know, running the building and things like that. So, you know, we have a business to run, and so being a partner is about both feeling engaged in that and part of that, but also there are the extra headaches of running a business, although, you know, we've got a really good manager and he does most of the work, to be honest. A salaried doctor's an employee, really, so we may employ salaried doctors in the way that we employ nurses or healthcare assistants or other staff, and they come in and they see patients and do visits and do jobs and, you know, do the phones and do all the other things that GPs do, and at the end of the day they go home and they don't have to worry about that running the business side of things. They also don't have to get involved in the financial side of buying into the business. They draw a salary. When their work is done, they're allowed to go home when their work is done. So it's often people quite like to start out being salaried or locums because they just want to focus on that clinical work, and as time goes on they think, actually, you know, maybe I want a bit more of a challenge, maybe I want to be a bit more in my own boss, be a bit more in control of things, and they might go into to being a partner. But that's not the case for everybody. Lots of people, and certainly around the country, you know, there are sort of big practices springing up where lots of people are salaried, and for, you know, people are even questioning whether long-term partnership is the future, and there's a debate, and the Royal College of GPs have set up a sort of, you know, an inquiry into looking at all the issues around that. So it's a time of change, I think. There's lots of challenges in any specialty. I suppose that the ones that sort of spring to mind would be change. I mean, I think it's the same anywhere, but it's just everything changes all of the time, and if you're trying to keep track of like everything in medicine, it just makes your head spin sometimes to try and keep on top of it all. And you don't have to be an expert in everything, but you sort of have to have a vague awareness about most things. And the number of times you realise, oh, that's changed and this has changed, and oh, I'm a bit behind on that. I guess you know, you just need to keep on top of things, really. I would say uncertainty. If you're the sort of person who, you know, really likes to have an answer to everything, and, you know, you want to investigate everything to the nth degree and have the scams of the super scams, and, you know, anything less just freaks you out, then don't do GP, because it's really quite a lot of the time you're saying things like, I'm not quite sure, I don't think it's anything serious, let's wait and see, I'm not quite sure what's going on, can we think about it for a bit? I don't know, lots of uncertainty, and I guess you need to be able to be comfortable with that, and you need to be able to help patients be comfortable with that. And I think the final thing is probably workload. I mean, one of the joys of GP is that people can access us. We're accessible to the community. They can ring me up, they can email me, they can come in, they can video call me, and all the other things that patients do. But I guess that can be a risk, because sometimes you just feel there's too much work. And certainly for GP, we've, in a bit like emergency department, at times we can feel that we can't control the flood of patients. I think we're getting better at that. We're getting more ways of controlling that, and it's not as problematic as perhaps you might think. But I think it would be unfair to not say that sometimes it's really busy. Yeah, so general practice in England or Britain is perhaps unusual around the world, because everybody's registered with a GP. I mean, almost everybody. There might be a few people who perhaps fall outside that, but the vast majority of the country are registered with a GP, and usually you need to go through your GP to access secondary care, unless you go through emergency department or perhaps a minor injuries unit or something. So pretty much everything that anybody wants the health service to do, they're going to come to their GP for. It won't necessarily be me that does it. It might be the nurses or the healthcare assistants or the administrators, but you name it, they normally come to us, and so they might access us, as I say, through internet, face-to-face, telephones, video consults, but ultimately they'll have a conversation with me or one of my colleagues, and we'll decide whether we manage it, which we do with 95% plus of the interactions with the people of Britain, or whether we need to refer it onto hospital, which we do in a proportion of cases. So the patients, and then, you know, we can see people at home, we can see people in our community hospital, we can continue to see them as we need to, and often we'll have a long-term relationship with them. But essentially, anything medical tends to come to us first, unless it's an acute injury, I would say, or serious illness. Well, I guess we've covered sort of getting in really, and recruitment and things. I suppose, again, I would reiterate making sure it's the right specialty for you. But if you've made that choice, or you're willing to give it a try, then really it's engaging wholeheartedly with what's on offer in the GP training schemes. We've worked quite hard over the years to do our very best to make it, and although we have a short training programme, to make it accessible for people from any country, any culture, any background to join us. We offer an awful lot of stuff in terms of things like enhanced inductions, communication skills training, half-day release training with lots of small group work, lots of supportive stuff, lots of stuff around knowledge gathering and stuff, and there's a huge wealth of advice amongst the training program directors and the people that work with them. And I would say really engage with your VTS, engage with your training scheme, because those people know what you need to get through, and they're going to help you and they're going to guide you. And the vast majority of our trainees do get through and they do enjoy it. The ones that don't are the ones that sort of don't engage, that don't take the advice, don't get stuck in, don't get involved with the groups, don't do the communication skills stuff, and they struggle, because I do think it's quite a big step to convert from a sort of a lot of people's hospital focused specialty training into a GP focused UK graduate in what is really a very short period of time. So that would be my advice: engage with your GP training programme. They know what they're talking about. I would just say thank you to Idris and Ibrahim for all they're doing with their website to welcome so many people to the UK. It's fantastic, and we really want to support it, and I think it's really valued, it's really special, and you're great, so well done, keep up the good work, thank you.